He focuses on holistic health, integrative lab work, and root cause medicine. Stefan advocates for medical freedom through a direct primary care model. His research includes alternative treatments like iodine, ivermectin, and lactoferrin, and he shares insight of healthcare reform and anti-aging through LinkedIn and YouTube. Please welcome Stefan Hartman from USA, who will be speaking on iodine for chronic disease prevention and management.
Thank you, everyone. So great to be here and speaking on this subject. At the end of this lecture, I hope everybody can become an iodine hero, as I like to call it. So yes, my name is Stefan Hartman. I'm a physician associate, master's in exercise science at Iron Direct Primary Care in Melbourne, Florida. I created this for a CME lecture, so that's something we do in the US when we don't have any financial disclosures. It's very important because iodine is a very cheap, if anything, free medication that can be used and that we should all be aware and using in our practices. So there's going to be some very solid learning points that everyone can take away at the end of this lecture. This will be very, I'm German, so I'm very straightforward and to the point, so you're going to get direct, actionable points in this lecture. You're going to learn that iodine is a global epidemic. You're going to learn that it is contributing to a host of diseases that you're seeing every day in the clinic. And then you're going to learn how to test for it and address it in your practice. One must read, and that I got a lot of my inspiration from, was Dr. Brownstein on iodine. It's a must read. And the WHO. The WHO estimates about 2 billion people on Earth are iodine deficient. And also, not just in the developing countries. I was not a believer in the first place either. I didn't think iodine is something that I would never need to think about in practice. But I started thinking, well, why do we have all this thyroid deficiency and so many endocrine problems? So I went and did my own study at my practice. So I'm looking at publishing this study that we've been doing for the past 2 years, and it's a retrospective analysis. So we just looked back at our lab data, and we looked at 3 different tests that you all can do. You can do a random urine iodine spot test, which is WHO approved. You can do serum, blood marker of iodine in the blood, and then you can do the urine halide challenge test, where you give patients a loading dose of iodine and see how much halide they excrete in the urine. What we found is more than 50% of our patients are deficient in iodine by WHO criteria. Mild to moderate deficiency, and some are oftentimes severely deficient. So these are the results of our random urine iodine test, which you all can order, and it's probably even covered by some of your state-sponsored healthcare plans. We found that most are deficient, median 88 picograms per liter, where if anything less than 100 is considered deficient by WHO standards. This is how you do the iodine challenge test. So you do a first morning void of urine, you capture this, and that determines the pre-test, right? Then you take a 50 milligram tablet of iodine, and you capture all the urine in 24 hours. And this determines the excretion of iodine. So say I take a 50 milligram tablet, my excretion rate is 25 milligrams captured in the urine. That means my body held on to 25 milligrams, and this determines the dose that you need to load the patient with for a time. So these are some of the results that we found in the serum, in the blood. Our lab reference range is between 40 and 100. And we found that most of our patients are somewhere around 46. And so this is way on the low end of the reference range. And blood tests, we're probably the first people who have ever looked at this, comparing urine and blood and urine halides, but no one's ever compared the two together, so it's kind of a unique study. But in that process, we also looked at the excretion rates of the toxic halides, which we're going to get to a little bit later, fluoride and bromine. And we found that they were also prevalent. We're going to discuss some case studies and some literature in this presentation so that you all can be heroes of iodine as well. This is a medical illustration that we all got in our training. We saw a kind of a third world population, bloated belly, the typical cretinistic features of a patient or a child that was predisposed to low iodine at birth and through developing years. So you see short stature, low IQ, developmental disorders, behavioral patterns. This sounds like something familiar. If you see a pediatric clinic, most children have problems with learning, speech delays, short stature, ADHD, you name it. So this may be what we're seeing in practice is a new 21st century cretinism in modern society. Cancer prevention and iodine. This is very important. Every month we see another breast cancer awareness, uterine cancer awareness. It's well established in the literature that populations with low iodine will have increased rates of prostate, endometrium, ovarian, and breast cancer. And right across the pond in Ireland has one of the highest rates of cancer in Europe. And they also have high rates of fluoridation in the water. And we'll get to that a little bit later, but fluoridation creates a competitor for iodine in the body. Japan, on the other hand, has low rates of prostate, breast, these sort of cancerous disorders. They have a high consumption of iodine in their traditional foods, which is seaweed primarily. Here in London, I have not had any seaweed in my stay here, and neither of the other European countries I've been visiting on my trip here to Europe. I have not eaten seaweed once. Where else are you getting iodine? Well, perhaps in coastal areas. My study is done on a coastal area. Brevard County, Florida is a barrier island where we have plenty of ocean to gather fish. My population is iodine deficient. 56% are iodine deficient, right? So they're not eating it in the shellfish. People just aren't eating the amount of fish. But we can easily supplement this. As I said, Lugol's iodine is an ancient remedy. Socrates knew about iodine way back when. It's been used for over 200 years. Apothecaries would formulate 2% Lugol's iodine solution and give it to patients 200, 300 years ago for various maladies. But we've forgotten to use this. But interestingly enough, one of the only protective conditions against breast cancer is lactation, because the breast milk concentrates iodine in the breast tissue to deliver iodine to the child, because the body is intelligent and it knows that to grow a child with a proper brain and height, you need to prioritize iodine. So lo and behold, how many women in your practice tell you, I had a pregnancy and then a child, and I blew up, I gained 30, 40 pounds, I then developed hypothyroidism. I see this every day in practice. And this, I saw this again and again and again. I'm like, why is this happening? Why are women so predisposed to hypothyroidism? We all learned that in school, right? Epidemiology. Women have more hypothyroidism conditions than men. Why is that? Well, we don't know. Well, I think we all know now at the end of this lecture. This is an old study, 1993, Ghent et al. They gave Lugol's iodine solution to women with fibrocystic breast disease. Fibrocystic breast disease is a painful condition of the breast. It's millions of doses of ibuprofen are prescribed around the world for this. It's a terribly painful condition. But now we're being politically corrected. We're no longer supposed to call it a disease. We're supposed to call it normal variant breast tissue. I was recently corrected by a breast surgeon on this at a paid medical conference. When I brought this up, you're like, no, we don't call it fibrocystic breast disease anymore. Because if it's not a pathology, you can ignore it. But we have a treatment for this. It's not ibuprofen. It's iodine, and it's well established. And it's safe, and it's cheap, or free. Here's Legolas with his quiver of Lugol's. Anti-neoplastic effects of iodine in mammary cancer. So we're going to talk about this again and again, how we can use iodine to treat tumors and prevent them. Iodide supplementation interferes primarily with the implantation and proliferation of mammary cancer cells. Iodine requirements are greater in the developing child, in the fetus. Iodine replacement prevents mammary dysplasias, or once established, the dysplasia is improved by chronic iodine therapy. And there is a correlation with endemic goiter and hypothyroidism and more cancerous disease, especially in men, which we'll get to in a little bit. Men, we won't forget you. We'll get there eventually. Dr. Kathleen Ruddy is a friend of mine, a breast surgeon. She's been involved in a lot of the ivermectin research that I've been involved in. She brought me onto this study. Is a viral. We just heard a great lecture on viral etiologies of problems. viruses potentially can be contributing to breast cancers as well. There's one that Dr. Reddy brought me onto. It's called the mouse mammary tumor virus. And this is a virus that can potentially be inhibited with iodine and selenium therapies. Antimicrobial effects of iodine. We all learned about this in the pandemic if we paid attention to the FLCCC and Dr. Peter McCullough. He pioneered the intranasal providone iodine solution. Every time I get on a plane here traveling, I spray it up my nose. Iodine dissolves viruses and bacteria on contact. So it's a very easy prevention of disease. Surgeons have been using it for decades to prevent disease before they make an incision. So iodine is naturally antimicrobial, and we can be used it. This is the case I had of a female with mastitis. She came to me, I was like, oh, it's clear as day, mastitis of the breast. I know the treatment, I learned this in school, it's ampicillin. So I prescribed ampicillin and said, this is the treatment, this is the mainstay of therapy, but just in case, apply some Lugol's iodine solution to the breast. And she never took the ampicillin. She said the infection went away. This is what it looks like on paper. This is with a company I can tell you about later. This is the pre-test and the post-test. You can see the excretion rates. This was an MD who came to me with breast cancer, and she was curious how deficient she was in iodine and how much toxic bromide she had. She had a superbly toxic dose of bromide found in the urine, 6.5 in the post-test. She also was about 50% deficient in iodine. So of the 50 milligram tablet of iodine I gave her, she required at least 20 milligrams for a treatment dose. She also was excreting fluoride. This is a uterine goiter case. This is a 30-year-old medical professional. She had premenstrual dysphoria, cramps, history of colloidal cysts of the goiter. She went to her GP, and they did the ultrasound, colloidal cysts. Don't worry about it. We'll just observe it, right? But why do they say just observe it? It's because they don't know this therapy that now you guys know. If you Google it, the first thing the AI will tell you is it's an iodine deficiency. You give the patient iodine, but a lot of GPs don't know this. So this patient suffered for a long time until we gave her iodine, and then she no longer needed to take NSAIDs, ibuprofen, for her menstrual cramps. And this was her results. She had 44% excretion of iodine. So anything less than 90% excretion of iodine is deficient. This patient held on to more than 50% of the 50 milligram of iodine that I gave her. And she was also excreting a lot of bromine in the urine. Again, these are some pictures of goiter. I was taught this is a third world problem. You're never going to see this in practice. But if you do enough ultrasounds, you feel enough thyroids, you're finding that a lot of people have large thyroids. They're having goiters in modern society. This is a patient with painful ovarian cysts with known iodine deficiency. We gave her 50 milligrams of iodine. She says she has 0 side effects. She's starting to lose weight, 10 pounds. She's feeling better, less fatigued. You notice patients feel more energy. Their cognition improves when you give them iodine. Like a little light goes on in their head. The farmers know this. So in Japan, the farmers have figured out that if you don't give the cows selenium and iodine, they grow cysts and they get sick. So the farmers are onto this, but the GPs are not yet. Periodic table of the elements. We learned this maybe a long time ago, and we memorized it, we forgot it, but we need to go back to this. Here we have the column called halides. You can see way at the top we have fluorine. Now fluorine, it only exists in a lab. In humans, it's always fluoride because it's highly electronegative. It immediately binds and becomes fluoride. Right below it we have chlorine, we have bromine. The bromine and fluoride are toxic. They have no purpose in the human body, really, other than competition and causing disease. And then we have iodine way down here. So, do you know, out of the halogens, which is the most powerful oxidizing agent? Well, the answer is fluorine, because it immediately binds to things. This study they did in Iran, they looked at fluoride in the tap water. They found that in areas where they had more fluoride than tap water, they had higher TSH and more hypothyroidism. And this is pretty well established, and now even the US has decided, at least Florida, which is a bit more advanced than other states, has decided to ban fluoride in the water. You European countries, you've banned fluoride a long time ago. I know when I grew up in Germany, in Berlin, we have a couple of Germans here, Germans, no fluoride. Fluoride was banned a long time ago because they understood how bad it was for people. In diabetics, it worsens insulin resistance. It worsens glucose tolerance. It's a low-dose endocrine disruptor, is what fluoride is. In our pharmaceutical drugs, we have a lot of fluorine, and it's because they add fluorine to the drug because they make it more potent. The steroid, the dexamethasone, it has fluorine in there. I say fluoride and fluorine synonymously because it immediately converts to fluoride in the body. Again, fluoride is only found in controlled laboratory settings. It's never found in nature or when you learn in school on the periodic table. Other common offenders, Cipro, ciprofloxacin, are statin drugs, fluconazole. A lot of our steroids do it. They just do it because it makes the steroid more effective and potent. So there's 325 drugs that contain fluoride. Indians, there's a grim report card I've had, this blurry thing I found in India. A lot of bromine in the bread products. So about 100 years ago in the US, they supplanted iodine with bromide in the bread products. I think European countries are a bit more advanced. United Kingdom, I think they banned it. But the USA hadn't until very recently. I think November 2nd, 2023, the FDA finally banned it in the US. They were putting it in vegetable oils, they were putting it in soda drinks, and they were putting it in bread products for some reason. So iodine was no longer being fortified in the foods. Now I'll get patients that are very, very holistic and they say, I don't want to take glucose iodine or a tablet. I want to get my vitamins from natural sources. Well, okay, you have to eat a lot of shellfish for this. You have to eat a lot of kelp for this. And they say, what about selenium? Because selenium doesn't have the same competitors. It's not in the halide column on the periodic table. So you don't need a whole lot of selenium to get the right dose. So I had this patient, he was eating Brazil nuts, because you'll hear this again and again, that Brazil nuts have high selenium. Well, the interesting thing about Brazil nuts is that they're really good sponges. They absorb a lot of things. So you have to know your farmer, and you have to know what the farmer is putting on your Brazil nuts. Because if you're not careful, like this patient, he was bromide toxic. And when I gave him a 50 milligram iodine tablet, he detoxed a high amount of bromide. I think it was 8.9. It was a high score. I'd never seen 8.9 milligrams of bromine in a urine sample. That's by any criteria very toxic. And he actually had a bit of kidney pain from that. But he excreted it. This patient was actually my dad. And he'd been suffering with a toenail fungus for decades. He didn't need a podiatrist. He'd had surgically removed. He would come back. The only thing that helped him was 50 milligrams of iodoral. And I gave him to it for 6 months. And his fungus finally went away. Demonstrating the antimicrobial effects of iodine. This is bromism. Unfortunately, bromide is also in a lot of our pharmaceutical products. What we give to asthmatics, ipratropium bromide, it goes directly into your lungs in the form of bromide. And lungs are this amazing absorber of medicine and nutrients. If you want to get a vitamin to a person or a medicine, have them inhale it because our lungs are great absorbers of this. Unfortunately, for our asthmatics, we give them steroids with fluoride in there, and we give them bromide, unfortunately. So maybe there's some safety issues with iodine. Well, first, experiment on yourself. And that's exactly what I did before experimenting on my patients, because I was an iodine skeptic a long time ago as well. So this is what I did on myself. I did the iodine challenge test. It wasn't as bad as some others. I had a 76% excretion rate. I had a lot of bromine I was excreting, and I had a decent amount of fluoride too, about 1 milligram in 24 hours. This was my thyroid function before I started any iodine. It was very low. My TSH was 5. My free T3 was 2.4, pretty abysmal. T4 wasn't bad. I just wasn't really converting to free T3. I had no thyroid antibodies, nothing to really complain about. I just had some subclinical hypothyroidism. I felt fine. I wasn't obese. I had energy. I'm just a go-getter. I started glucose iodine, about 2 to 3 drops, and my TSH stayed about the same. My free T3 went up to 2.9, so I was kind of pleased with that. My free T4 went up. But I was still cold. My wife would complain because I would always say, why are you making the AC so cold in my house? I'm freezing. And she was always running hot. This is the water I had been drinking for years in this plastic container, right? I And this company, they came out to my house because they wanted to sell me a reverse osmosis system. And I think the scam was they wanted me to test my RO test my tap water so that I would buy their system. I said, no, I want you to test your own water because it was from that same company. He was like kind of surprised. He tested it. My water was full of PFAS. PFAS are forever chemicals. They're mega fluoride atoms, carbon chains. They never go away. I mean, I'm trying to find a way to make them go away. Maybe some of you guys can teach me how. But the best way is to avoid these. But unfortunately, they're everywhere. They're in the meats, they're in the foods, they're on the plastics, right? Someone mentioned earlier. And they're in your plastic water containers. I was drinking this for years, unfortunately. And same as my family. We all have hypothyroidism, and most of my patients have hypothyroidism. I had gotten a little bit frustrated for a time because I was taking 12 milligrams of iodine and my thyroid still wasn't improving. So I ended up going up on NP thyroid. So I take desiccated thyroid hormone now for thyroid replacement. I may have overshot the mark a little bit, but I feel very good. This recently before the trip, I didn't take it just to see what would happen, and my thyroid is pretty much the same. So it looks like if I want optimal thyroid function, I need to be reliant on this medication. It may just because my thyroid has been contaminated for so long. This is an extreme case. This is a 33-year-old female who opted to take 300 milligrams of Iodine in an attempt to kill cervical cancer. We noticed that her thyroid peroxidase and her thyroid globulin antibody, they never went up. So the one pushback I get against iodine therapy is it causes autoimmune antibodies. And this is the case. I've seen it happen a couple times, even with super low doses. I think some of this might be nutrient deficiencies, not enough selenium, obviously. They might be killing off a fungus or a bacteria, and they're having a little bit of immune reaction to that. So sometimes you need to go really low and really go slow. You need to load them with the vitamins, the B vitamins, the selenium, so they open up their detox pathways before starting them on the iodine. This one's super important. Magnesium and iodine. There's a role between these two. We're going to get to that. Placental tissue iodine levels and blood magnesium in preeclamptic and normal pregnancy. So they found in this study, it's one of the few studies of its kind, that they looked at the placenta of women with preeclampsia and found that the placentas were iodine deficient. Now, the typical treatment for preeclampsia is magnesium, but why do they have low magnesium? It's low iodine. Placental tissue iodine levels in blood magnesium. So this is a study done in northeast Anatolia where iodine deficiency is rampant as well. Right? It's kind of a landlocked area, right, in the mountains. So we need to be considering iodine for our pregnant women as well. The amount of iodine in the human body, about 50 milligrams. But 30 milligrams is in the thyroid, but the rest of it is in other tissues in the body. And no one knows why is iodine in other tissues in the body. What purpose does it serve? From our epidemiological understanding, we think it might serve as a bit of an antioxidant. And it serves as a preventative measure against various cancers. Now men, I haven't forgotten men yet. Joe Biden was recently diagnosed with prostate cancer. Do you think his doctor was assessing his iodine levels? I don't think so. It's not a routine lab screening we do. Thyroid disease is associated with an increased risk of prostate cancer. Normal and cancerous prostate cells can uptake iodine, and depending on the chemical form, it exerts an anti-proliferative and apoptotic effects in vitro and in vivo. Iodine is an antioxidant and anti-proliferative agent for the mammary and prostate glands. So, iodine isn't just for the thyroid. It's for other tissues as well, and men as well. You cannot forget men. So this is a patient case example. Hashimoto, she came to us, pretty high thyroid antibodies, very high. We give her selenium, 200 micrograms twice daily, BID. We also started her on low-dose naltrexone, which is a whole nother lecture. If you want to learn about it, go on the ldnresearchtrust.org, great British society that pioneers a lot of this research. So we give her on these two, and a little bit of iodine, but first we load her with selenium, then we start iodine gradually, and we can see the thyroid peroxidase decrease and the thyroid globulins completely evaporate, gone, right? So what's the traditional treatment for that? None, right? No one really knows how to reverse thyroid globulin antibodies and thyroid peroxides, but we are doing it at my clinic on a routine basis. Selenium, B vitamins, of course stress management and so forth, and low dose naltrexone. Postpartum lactating labs. So the postpartum is the area where women will start developing hypothyroidism, where they're feeding the child on the breast tissue, they're depleting themselves of iodine and nutrients. So many women will develop hypothyroidism. So this patient was hypothyroid. She came to us, her free T4 was 0.8, her free T3 was 2.4. We replenished her with iodine, 12 milligrams a day, and selenium. And we brought her thyroid back. It came back free T3 up to 3.2 and free T4 up to 1.3. So, easy enough solution. This is one of my last cases, and I like it because it's a visual demonstration. This is a 42-year-old female, standard American diet, really not healthy, didn't exercise. She came to me pretty scared with these thermography findings, thermography I should say, showing that there's some concerning changes in the breast tissue, some hot spots. We did the test on her. We found that she had a 62% excretion rate on the iodine challenge test, so she required at least 20 milligrams of iodine per day. So we put her on this for about 6 months, and the thermography shows nearly complete resolution of the hot spots in her breast tissue. This here on the right is the after, this on the left is the before, so it's about a year in between therapies, but you can see here and here the differences in the hot spots. So this is what we did. Instead of sending her immediately for a biopsy, I typically recommend load the patients with selenium, iodine, optimize their hormones, and then reassess the scan, see how it progresses. Unfortunately, if you go really too quickly to the biopsy, or the mammogram, you get a lot of panics. First, iodine optimization, selenium optimization, diet optimization, and see how it goes. So in summary, iodine deficiency is happening globally. You probably have it in your practice. You see it every day. You're not aware of it because you don't test for it. Our findings at our clinic in our coastal area found that more than 50% of patients are iodine deficient by WHO criteria and by the iodine challenge test and by serum testing. You can become an iodine hero today. It's very easy. You get a legal solution, put a few drops in your water, get some selenium. You can start tomorrow. You can try to eat more kelp, but I don't see any Japanese people here. It's not really part of our culture. We don't eat kelp. I don't know if it's going to happen to the degree that the Japanese do it. So here are some of my references. There's quite many references here. And this is where you can find me. You can find a lot of my YouTube lectures here. I have hundreds of hours worth of these type of lectures. And my LinkedIn, Facebook, and Instagram, where I post on occasion. You can contact me and visit my clinic sometimes. We have a cold plunge, we have a sauna. It's a fun place. That's all. Questions? Yes.
So you said you don't prescribe iodine straight away. So you start with selenium and B vitamins.
Yeah.
And then go on to the iodine.
Yeah, if they have, especially if you've done some blood testing and you see they have some thyroid antibodies, yeah, for sure. But most people will be fine with a couple drops of iodine. You can start them out that way along with B vitamins and selenium.
Right. Thank you.
Yeah.
How careful do we need to be about not taking too much iodine? Because I've also heard stories about being very careful because going the other way can also be.
Yeah. I think once you reach saturation, you can decrease the dose on the iodine. So you can start the patient out, again, you do the iodine challenge test, you determine this patient needs 25 milligrams of iodine today. You do that for a time, then you can retest them and see what their saturation level is. And so they may need maybe a drop a day at some point, 1 milligram a day. But initially a loading dose may need to be higher, aggressive treatment, especially if you have a concerning thermography finding, or if you're treating a fibrocystic breast disease or a prostate cancer, prostate proliferative, any one of these, endometriosis, any one of these, load them with the iodine, get them feeling a little bit better, and then maybe later on they need a drop a day. Yes?
And this testing, I have a hard time getting access to tests.
Yeah.
Is it at all reliable to do the skin test?
People have asked me that before. I haven't studied that. I haven't compared it to our others, but that would be a good study to do. We should compare that next time.
Because I've heard of putting some iodine on your skin and then measuring the number of hours it takes before it gets absorbed and...
Yeah, I've heard of it, but I don't think it's ever been validated.
Okay.
Yeah, that's all. Yeah. Anybody else? Yes, way in the back? Yes, sir. Yeah.
That's great. You know Sarah Myhill? You know Sarah Myhill?
No, I never met her.
Oh, okay. So the UK, she's big on the iodine teachings. So I'm completely with you on all of this. The thing I found in my clinic though is because we do so many different tests already, you're always trying to think, right, you can't do everything, yeah? So my approach currently is, unless we're seeing abnormal thyroid function, significant abnormal thyroid, I'm not testing urinary iodine, but I'm pretty much sticking everyone on kelp.
Yeah.
What would you say about that sort of approach?
All my patients need to be on iodine. The first thing I ask them when they come for a follow-up business, are you taking your iodine? This is my first question. Do you take your iodine?
So you're doing urinary iodine on everyone?
Well, we did it as like a test of concept. That's how we got all this data in the first place. We did 180 tests. We proved it to ourselves. Okay, 50% of our population is iodine deficient. We don't need to continue testing, wasting money. But if a patient is like, well, they don't believe us, okay, we'll test you. Sure, we'll prove it to you.
Well, that's why I thought you put more than a couple of capsules of kelp a day. Or would you say it's just grossly insufficient?
Well, it depends how many milligrams, and depends how deficient they are, and if they have any sign of iodine deficiency, right? Did they have fatigue, pain, menstrual cramps? Do they have prostate problems? Do they have endometriosis? Do they have breast tenderness? Do they have low thyroid function? Learning disabilities? They need iodine. So if the clinical signs of iodine, they need probably a higher dose. The kelp, you need to look at the dose. The problem with the kelp is how many milligrams of iodine is in that kelp. That's the problem with the Japanese studies, is because we don't know how many milligrams they're actually taking. The idea is between 13 and up to 25 milligrams a day in Japanese studies, but no one knows for sure because you don't know how much iodine is actually in the kelp.
Yeah, the kelp is much lower than what you get through the pills.
Right. Yes.
Selenium, what is your empirical dose that you start people on, and how long do you keep them on it?
Yeah, 200 micrograms twice a day, so about 300 micrograms on average daily. Yeah.
And your patient, what guy's your treatment? You bumped her up to 400 a day.
Yeah, so that's usually what I do in a multi, because I take this multi and I dose water-soluble vitamins twice daily. So if you take this multi twice daily, it equals about 400 micrograms total. But psyllium is just a water-soluble one. It doesn't have competitors, so you can get even 200 micrograms a day, you'll be fine. Yes?
Compliments for your presentation. So I would like to know about how you measure iron as a ferritin. And the second, how long do you treat your cycles of therapy with selenium?
So the question was, how long do I treat with selenium? And that's indefinitely, right? It's the same with all the B vitamins. Everyone's deficient, right? They need to be supplemented. I mean, they try to eat the Brazil nuts, but as we demonstrated, the Brazil nuts are full of bromide. So everybody needs selenium, everybody needs B vitamins. As far as the iron and ferritin, yes, we measure those. Women definitely need more than men. Men sometimes accumulate iron and ferritin because we don't bleed every month. So I typically will recommend women to either eat beef liver if they can stomach it, or at least steak on a routine basis. I don't recommend iron pills because it's hard on the digestion. Yeah.
And what is your point of ferritin? What is your number for women?
For women, over 200. Yeah.
200.
200. Especially young menstruating women. I mean, they get. I see a lot of anemia. I don't know in your practice, but the women in my practice who are menstruating, they're anemic, like all of them. So they need a little bit of a reservoir because their hemoglobin's maybe borderline 12, 11. If they go low, they're going to be passing out. Yeah, not for men. Men don't need it as much. Yes?
If someone has normal levels of iodine in their urine, would you still consider supplementing them?
I've never seen a patient with a normal level of iodine.
I have.
You have? Okay.
Yeah.
Well, maybe like high iodine, maybe on a couple occasions, or like good, but it's hard to determine what is normal unless you do the iodine challenge test. I've never seen a patient score greater than 90% on an iodine challenge test, which is probably the best way to determine if someone is normal. I've seen someone come close, about 82%, but never 90%. On the urine spot test, you can get a variety of ranges. If the patient is taking iodine and does a urinary iodine spot test, it's going to be high because they're excreting the iodine through the urine. That's where it goes. So dosing iodine, if they're taking iodine, is not useful.
If they're not taking it, but they've got a normal reading in their urine, then is it unethical to say you should take iodine supplements?
I would say the urine spot test is not a useful test to determine if someone's normal or not. You have to do the iodine challenge test to see, one, how much fluoride and bromide they detox from taking the iodine, and then what their saturation level is. If they're scoring above 80%, if they're scoring above 90%, this patient is iodine sufficient, and they don't need iodine, or they need maybe a couple times a week, 1 milligram.
Right.
Right.
Okay.
Yeah.
Mention how much care is spent on the person and family, because my grandpa passed away with pancreatic issues, and my older sister had hypothyroidism. So just be interested to know, is it something that some families might be more susceptible to?
No, I think everybody's susceptible to it. I mean, rats, cows demonstrated iodine deficiency. I think most mammals are susceptible to iodine deficiency. Like a lot of studies demonstrating tumor, it's in rats, right? Cows. The farmers know that there'll be iodine deficiency. It's not just humans. Yeah. Yeah. Very good. Thank you. There you go. Very nice.